One of the medications that we get asked about a lot is Losartan. So this is an aldosterone receptor blocker. Good medication for high blood pressure. Does have side effects, does have indications other than high blood pressure. So we're going to spend a little bit of time and just talk about it some more. So once again, it's an antihypertensive or medication that is used for high blood pressure. And definition of high blood pressure can be different for a lot of people, but typically I utilize a number of 140 or above that has been sustained with associated and organ damage, whether it's enlargement of the heart, kidney issues, liver issues, TIAs, or mini stroke-like symptoms. So if someone has that, then I want them to be on something to help control the blood pressure. First thing I'm going to do is lifestyle changes, watching what you're eating, weight loss, exercising, watching the foods that you're eating. When it comes to lifestyle changes, the biggest thing that you can do to help decrease that blood pressure is watching your sodium intake. But if after all those lifestyle changes, your blood pressure is still elevated, then we want to incorporate medications to help with controlling it. And one of them is aldosterone receptor blocker, ACE inhibitor. One of the reasons that people get switched to that medication is due to ACE inhibitor or something like a lisinopril causing a cough. So if someone has a cough, typically I will switch into an aldosterone receptor blocker such as Losartan to see if it will help mitigate that. A lot of times that cough completely goes away. But other than that, if someone's had a cardiac event, heart attack, enlargement of the heart failure, you want to utilize this medication. It improves the outcomes. It improves the improvement of the ejection fraction, the heart squeeze function. Other indications, if someone has diabetes, you want to use this medication. You want to use this or an ACE inhibitor to try to slow down the progression of the kidney disease, preventing them from becoming end-stage renal disease. If someone has an enlargement of the aorta or an aneurysm, this medication is good for preventing, reducing the progression of the enlargement also. But like I said before, this medication is not without its own side effects. The biggest ones that people will complain about sometimes is that their potassium levels can be a little bit elevated. So when you're starting this patient on this medication, definitely want to recheck some labs to make sure that it's not affecting the potassium. There is some crossover that people who have a cough with ACE inhibitors like lisinopril will also have a cough with a aldosterone receptor blocker such as Losartan. So you definitely want to see their symptoms and see hopefully that the cough has significantly improved. Now, if people have progressive kidney disease, this is where it becomes tricky in utilizing it, because if it's progressed further, this may actually make the kidney disease worse. So if someone has stage 3, stage 4 CKD, definitely want them, number one, to be seen with a nephrologist to make sure that all the other medications, all the other plans, the future plans is that we're not fighting against nephrology, because sometimes cardiology and nephrology, Dr. Glaucofalcon talks about it a lot, but at the end of the day, we want to do what's the best thing for the patient. So aldosterone receptor blocker, Losartan, good medication for heart failure, hypertension, CAD, enlargement of the heart, enlargement of the aorta. Does have a side effects of elevated potassium, can sometimes still cause a cough. You want to be careful in using it in people who have progressive stage CKD, making sure that those individuals are also being seen by a nephrologist. If you guys got any questions, let me know in the comments.